Hello everyone, I am Neha Khan from second year MBBS. Today I will be discussing the topic motivation of patients with chronic disease to adhere to prescribed management by healthcare provider. The topics which I am going to discuss under this topic are the first, compliance; second, factors affecting compliance; the third, method to enhance the compliance; the fourth, over compliance; fifth, evaluation of patient compliance; sixth, doctor compliance; and the last one, some ways to motivate patients achieve compliance. Let's move on to the first topic. The first topic is compliance. Compliance of the treatment is very important for the successful therapy of a disease, and it has two components, the patient and the doctor compliance. The consumption of medication as per the advice of clinician is the patient compliance. Adherence to take the drugs prescribed by clinician. Therapeutic response is achieved when correct prescription is written and patient takes the medication as per the advice. Sometimes treatment failure may occur due to various reasons, and one of the very important reason is the failure to comply with clinician's instructions. That is, if a patient does not follow the advice due to any reason, treatment failure occurs, and then everything becomes a futile exercise. The second slide is factor affecting compliance. The first one is financial, that is poverty. So many patients cannot afford a drug, and thus it is advised to use economical, cheap, generic drugs and economical, cheap brands without compromising the quality of treatment. See above cost and price of drugs. The second one is non-financial factors, lack of motivation, lack of information, unable to understand the instruction. Clinician's personality, patient is not satisfied with the doctor, poor communication with patient, poor patient-doctor relationship, unpleasant side effects, forgetfulness, unintentional non-compliance, compliance regimen and more frequent administration of drug and duration of treatment, polypharmacy, more frequent administration, multiple discases. Others, patients' inappropriate health beliefs and lifestyle, severity of disease, patients' education, elderly patients, psychiatric disease, unstable family. The third, methods to enhance the compliance. Good patient-doctor relationship, like good communication, give oral, written information to patients, allow patient to ask the questions and let them clarify anything not clear to them. Dispense in patient's friendly package. Associate the drug intake with routine activity such as during breakfast or during bedtime wherever possible. Use FDCs, for example, tuberculosis of injectable depot preparations for psychosis, regular follow-up, give reminder with the help of computer if possible. Prescribe economical drugs, that is some quality of treatment with cheaper drugs. Overcompliance. In certain optional patients, their routine life is based on single program. Such patients, when take medication, they may consume the excess dose of drug. For example, in chronic disease like glaucoma, there can be serious consequences such as blindness if medication is not taken properly. Now, if the consequences are known by patient, then he or she might take excess dose of the medication in order to treat the disease fast. This can be avoided by adequately educating the patient about their disease and the side effect of taking medications in excessive dose. The evaluation of patient compliance. The compliance of the patient can be ascertained by following methods. Number 1. Asking patient to come with the container for drugs. However, the patient may have discarded the drug, so not really reflect whether patient has consumed the drug or it has been discarded. The second, physiological markers such as measuring blood sugar for anti-diabetic drugs, BP for antihypertensive drugs, and counting heart rate when beta blockers are used, etc. The number 3, measuring the concentration of drug in plasma, urine or saliva. Therapeutic drug monitoring is sure guide whether patient has taken the drug or not, and this of more important in cases of drug for epilepsy and psychiatric problems, etc. The most important, doctor compliance. Doctor compliance is the next to the doctor compliance is the extent to which doctor act in accordance with the ethics to perform their duty. The following are some important qualities required for a doctor who has good compliance. To write a correct prescription based on their efficacy, safety and economy. Avoid over prescribing. Prescribe minimal possible drugs and avoid unnecessary medication. To write legible prescription. To inform the patient what they should know, should not be ignorant. To adopt recent advances if proved substantially and if actually needed. Failure to comply the above may lead to undertreatment, overdose and drug interaction, etc. It has been found that often prescription does not conform to the hospital guidelines and mistakes include incorrect dose, route, frequency of administration, etc. Errors may be in error of drug use and error of prescription. Errors are more likely if multiple drugs are prescribed, more than 4-6 drugs, and if it is particularly more common with the cause of antimicrobial agents. It has been found that doctors are often ignorant and they prescribe those drugs for which they do not know, and thus it is very important to know about a drug before prescribing, and if they do not know, it is better not to prescribe that drug. The last, moreover, clinicians are often not aware about the cost of the drug and their financial implication on patient, particularly if treatment is lifelong. Now we are discussing some ways to motivate patients achieve compliance. The number 1, set simple goals. The number 2, educate patient with handouts. The number 3, make community connections. The number 4, host a workshop. The number 5, give homework. And the last, eliminate obstacles. So now I hope you guys have understood what I am explained above. Now you will be able to solve all the MCQs mentioned ahead. Now I would like to end my lecture. Thank you for listening to me. Goodbye guys.